nurse-led health conversation. Today we'll be talking about common cancers affecting. Today we'll be talking about. Sorry, I'm trying to get on something. You're welcome. You're welcome. Okay. Okay. So, good day, everyone. I'm Nurse Mimi Miracle by name. I'm a registered nurse of Nigeria, and I welcome you to today's live session. This month, the theme of this month will be on dehydration, and will be on fatigue and the rest. That persistent tiredness, many people normalize as nothing wrong, everything is fine, I'm good, and so on. Today, we are focusing on one silent and often ignored cause of fatigue, and that is dehydration. Dehydration is a silent cause of fatigue. Like I said, the theme is fatigue, and we are looking at dehydration as one of the silent cause of fatigue. If you are joining this poll, you're joining this live session, you're welcome. Just drop a comment in the chat box. Let's know where you are joining from. Just let us know where you're joining from. You're welcome. Oh, you're welcome, Oracle TV. You're welcome. You're welcome. Thank you for joining. Okay. So straight ahead, I will be going on with this conversation. First, I'll be dropping a poll. Remember, I told us that we are discussing one silent cause of fatigue. Fatigue simply means tiredness. You're always feeling weak, exhausted, even when you've really not engaged so much in any activity. So I'll be looking at one silent and often ignored cause of that tiredness, that fatigue, and which is dehydration. Now, what is dehydration? Dehydration is like the word then hydration. The hydration itself is having a lot of water, water, hydration. Then D means less. So when you talk of less intake of water, then you have dehydration. So that is a simple but easy way of explaining what dehydration is. And then that is a great way to. So I'll be sharing an interactive poll on the screen. Please engage while we flow along. Thank you. Okay, so here we go. How many glasses of water have you had today? So feel free to answer. We are not here to judge anyone. We are rather here to enlighten ourselves so that we can be better and healthier. So how many glasses of water have you had today? 0 to 2, 3 to 5, 6 to 8, more than 8. So I'll be expecting a response to this poll. So I'll be leaving this poll for say 60 seconds or so. How many glasses of water have you had today? If you are joining, please give this video a thumbs up. It helps the algorithm know that we are sharing healthy content that helps us better off. So how many glasses of water have we had today? You're welcome. If you're joining this live, you're welcome. Please drop a hi and then join us as we do the poll. Respond to the poll. Thank you. Now, so thank you for responding. I can see 6 to 8. Okay, thank you so much. 6 to 8 is a very good one. It's a very good one. So if you choose 0 to 2 or 3 to 5, I want us to remember that your body already is sending some warning signs, especially when you had a very hectic day. It will be sending some warning signs. Water is essential for blood circulation, temperature control, digestion, and brain function. Without water, your body circulation, like the way blood flows, it needs water to lubricate it so that it can flow easily. Your temperature too, if you don't take enough water, you'll be running fevers unnecessarily. Then digestion. I know a lot of people who struggle with hemorrhoids, what they call pile, like they have problems with their rectum is sticking out and the rest. And most times, if you look, trace very well, you will see it is related to dehydration, not taking enough water, not taking enough water, and that affects it. Your digestion, it's your stool becomes very hard like a stone. Then you begin to struggle. Most people suffer anal tear and it becomes some other complications. And really, you don't want that. So this all together, your brain function, water is also necessary. That's why you feel fatigued when you've not had water. There's really nothing that can replace water, and that's why there's some people say water is what life. So taking sufficient amount of water helps us to stay healthy and be happier. So I'll be ending this poll now so that we move to some other core segments. Thank you for responding. Okay, so as nurses, we often see patients complaining of weakness, headaches. Then lab tests come back as normal. Like we say, okay, go and do malaria test or do some other diagnosis as prescribed by the health professionals. And then they go and they come back normal. And then if you look, they are really not actually sick per se. They are just dehydrated, and few cups of water would help them get revitalized and get going. So please, adequate water intake is key. It's very key. So now let's see signs your body may be dehydrated. What are those signs your body will be telling you that, please, I need water, give me water? Sometimes your body tells you those things, but you try to waive it. Or sometimes your body may tell you, I need water, and you are like, let me take soda instead, let me take Coke. So in this live session, we'll be pointing and illustrating a lot of things and why water should never be replaced with something else. Water is water. You don't replace it with something else. Even if you take fruit juices, you still need to take what? Water. So I'll be moving on. The first sign I'll be pointing out is persistent fatigue and low energy. Remember, fatigue is also known as tiredness. Other words you can mention is tiredness, weakness, and so on. So persistent, when the thing is continuous, when you say something is persistent, that it's continuous. In one of my videos, I emphasized on 3 P's that speaks that you should watch out for when you have a sudden challenge, and those P's are pointing factor to let you know that, see, at this point, get to the hospital, go and see your health professionals, and they will help you out. So most times people ignore that, but if you go to that video, you see a lot on that. Then persistent fatigue and low energy, you're always tired, frequently tired. See, I would even advise for those of us who would be engaging in fast, complete dry fast where you take no water for a long period is very, very harmful to your body. Very harmful to your body. Complete dry fast. So water helps. Even though you are not on food, taking water for certain periods will help take go a long way. So please ensure you take water alongside. Then we have dehydration reduces the volume of the blood, meaning less oxygen reaches the muscles and the brain. The results, you feel what? Drained. Let's take it this way. You feel dehydrated. There's no enough water flowing, and then the blood becomes very thick and they are just stagnant, they are not moving. Before you know, your brain is starved of blood. And then this same blood is supposed to carry oxygen to the muscles and nutrients. They don't get to the muscles. So there's no muscle to move around. So you get tired and you get weak. So it is necessary that you check that. One of the first signs I said is persistent fatigue and low energy. Now we have the sign number 2. We have headaches or dizziness. Headaches or dizziness. I know headaches. If you are joining, thank you so much for joining. You can say a hi on the chat box and then we continue to flow along. This channel is, and today's discussion is basically on signs that you should watch out for. Some signs that tells your body is telling you that you are dehydrated. Some people don't recognize these signs, so I'll be sharing a few of them here, and stick with us as we continue. Oh, Favor Dechi, you're welcome. Thank you so much for joining. I really appreciate your presence. Thank you. So the second sign that you are dehydrated, the first one I said is persistent fatigue, that's tiredness and low energy. Next one is headaches and dizziness. So you feel, have you had that kind of feeling where you wake up and you still feel tired, you feel like you should continue sleeping? You're trying to wake from sleep. You've been sleeping for a long time, but you're trying to wake from sleep. Oh, thank you, Favor Odechi from Abia State. You're welcome. You're welcome. Thank you so much. So you've been sleeping for a long time, but you're trying to wake up from sleep. That is a sign that you are dehydrated most times. If you take some water, it will help you. And in one of my videos, I emphasize that first thing, the first golden hour, the first hour before, after you've woken up from bed, you should ensure you take water, a glass of water. Drink water. It helps to cleanse the system, revitalize. Tell your body that wake up. Yeah, today is another new day. So please take water. When fluid levels drop, the brain temporarily shrinks and triggers headache. So when the level of fluid, that's water in your body, drops because you didn't drink enough, the brain will shrink, and then it causes that temporary headache because there's not enough fluid going to the brain. Now the third sign is dark yellow urine color. Dark yellow urine color. If you really observe your urine when you are dehydrated, you'll be able to tell the difference. It's very dark, like, what can I use to describe it now? What can I use? But I wish. Okay, it's not usually like Fanta, because Fanta is a different color altogether, but it's very dark. You can see it and like, what's going on? If you are joining this live chat, thank you for joining. Thank you. So this next sign of dehydration is dark colored urine. So this signs now helps you to monitor it. The fourth sign is dry mouth, dry lips, or bad breath. Sometimes some people's lips are cracked to tell you that they are dehydrated, but they are still moving on. They've not even taken water. For you to even allow dehydration to the point of cracked lips and you are just going on, it's really not healthy for us. So ensure that we take enough water. Saliva production drops with dehydration, increasing oral dryness and bacterial growth. When you are dehydrated, if you even close your mouth for just few minutes, open that mouth again, it will be smelling everywhere. People will be wondering, God, kai, mouth odor. and it's not good for us. You don't really want to have that experience. So dehydration helps to prevent that. The fifth sign is dry fog or poor concentration. Many people think this is stress or burnout, but dehydration directly affects your cognitive performance. You are very thirsty. I've seen people having to carry um, a bottle of water into the exam hall because certain point they'll be seeing double vision. They are not being able to to be able to write. They are so dehydrated. So when they take the water, it helps to help their cognitive performance. I'll be dropping a poll now for those on joining on this live. Please, let's partake in the poll. It helps to keep this live session very interactive. So let's go. Which affects you when you are tired? I've just spoken about 5 signs of dehydration. That's what we are discussing today. Signs that you should watch out for dehydration. So which affects you affects you more when tired? Sorry, I'm on. Which affects you more when tired? So there are no right and wrong answers. We just share our experience. We learn from each other on this live session. I appreciate you joining live. There's nothing like it because although I know some other persons will be watching the replay, but live sessions are more interactive and we'll both learn from each other. Thank you very much for sticking through. Thank you. So I'll be dropping the poll now. Okay. So which affects you more? If you can see my poll, please respond to it. Drop your votes. Which affects you more when tired? Which of these signs of dehydration affects you more when you are tired? Is it poor focus? Do you begin to have poor focus? Do you have bodiness? Or do you have both? Do you have both? So let's send in our votes. Please like this live session. It helps tell the algorithm that I'm offering value and you really appreciate it. You can like it click on the like button. Thank you. So we have body weakness have 50%, both has 50%. Okay, that's great. So body weakness for some is one of the key signs for them that they are dehydrated, while both poor focus and body weakness are signs of dehydration. Thank you very much for this poll. Some people are prone to dehydration related fatigue, that's tiredness. So we want to look at those people who are prone. Number one, we have busy professionals. Example, nurses. I had to be very intentional as a nurse. After working for some time, I just look at the time and sneak into the nurses' room, take some water and come out because I cannot be carrying the water around, right? It's not safe and it's not healthy. So I just go wash my hands, go and take some water and come back. If not, you can just experience burnout working for hours without taking water is not healthy, and you need to be healthy to be able to serve others and keep them healthier. So I even also encourage patients to take fluid. Those who can take it by mouth and those who may not be able to take it by mouth, we ensure that the fluid they are taking, the intravenous fluid, are sufficient for their body to keep them going. If there's any deviation, we pick it from one of the signs. Who can tell me that sign that we can easily pick dehydration? If you are very very observant, a sign that you can easily pick one sign. Yes, I'll be dropping the quick Q&A session. So I want you to reply this question. One sign, tell me one sign that helps you quickly note you are dehydrated. Okay. Favor, you say breaking lips. Wow, breaking lips. Breaking lips is one sign of dehydration in people. That's true. In some persons, yeah, yeah, yeah. But before I even get to breaking lips, that your skin is now telling, there's one very factual sign that picks that, I don't know who can get this for me. Aside that, breaking lips, to me, it can happen, dehydration that can occur over 24 hours. But this one, within 24 hours, your body points to you that you are dehydrated. Can you? Okay, bad breath. Bad breath is another sign, yes. Bad breath. But that's if someone even come close to you, right? I mean you. I mean a sign that you yourself can pick yourself. It's not even someone picking for you, because bad breath, well, you can also tell bad breath yourself too. If your mouth smelling, you can tell. But well, I'm still looking out for one. Give it a try once more. Give it a try once more. Okay, body weakness and eye toning. Yeah, yeah, yeah. Body weakness. Ah, you really tried a lot. You really tried a lot. I really appreciate. Oh, thank you so much. Body weakness and dark color urine. Okay, so but I think, oh yeah, dark urine color. Yeah, yeah, yeah. Dark urine color. You know, at most before the end of the day, let's say in 6 hours, you should urinate. In fact, if you've not urinated in the past 6 to 12 hours, then there's a problem. Oh. Because your body is filtering waste, and where is the waste being stored? So you must, that means it shows you are dehydrated, and your body is just being stored. And that's how people develop kidney stones. Kidney stone is a deadly disease that affects a lot of persons because of they are dehydrated, and it causes a lot of problems. So dark colored urine is one key note sign. These other ones, you are also correct. Body weakness, eye turning, and the rest, breaking lips, bad breath, they are also correct. But this dark urine color, you can pick it as early as 6 hours, between 6 to 12 hours. If you urinate and you see your so dark, like I can't even, I'm still here to find out what I can use to describe it. Then you know that you are dehydrated. Immediately after urinating, go and take water. Please, we should not always take water only when we feel thirsty. We should take water ideally because it is necessary. So other people who are prone to dehydration, aside busy professionals and health workers, we have pregnant and breastfeeding women. They are prone to dehydration. Older adults are prone to dehydration. Thank you so much for joining, and thank you for so much for staying up to this moment. We are looking at people who are prone. So if you fall in this category, you know, like many people who are into businesses and the rest. Let's say someone now that is a fashion designer, is trying to beat targets. As he gets to the money, starts, cutting the designs. Next thing, he mounts on industrial machine, starts, sewing. He won't even know when it is 3 p.m. and then next is 6 p.m. He has not taken a single water. It's not healthy. Some of them even stay long without eating. If you want to stay long without eating, please do not stay long without drinking water, because it's going to cause a lot of harm to your body. Then we have older adults or grandparents and the rest, people with diabetes or on diuretics. I will tell you reason why these people are also falling in this category of easily getting dehydrated. Now, people who have diabetes, one of the tell signs of diabetes is excessive urination, right? So now they are urinating and they are not taking more fluid to replenish the one they've urinated. Come on, the body will go short on fluid and they will be dehydrated. Then people on diuretic is a kind of drugs that people take to prevent, maybe they having some slight kidney issues, kidney failure and the rest, and so the fluid is, some people when they move, you see their legs is a bit swollen, that is fluid is gathering, and then the doctor prescribe those drugs for them. Now those drugs is to help to drain those fluid so that they urinate it out. Now those fluid are drained because they are on that drug, but they are not taking fluid to at least balance up. This would also affect. So people who are living in hot climates, Nigeria is hot too. Nigeria is hot, and especially the north of Nigeria, very hot. I've been there and it is very, very hot. So take notes in hot climate, when we have these very high temperatures and the rest. If you notice you are excessively sweating, know you are also losing fluid o. So try to replenish it with water, drinking water by mouth, because the fluid is coming out from your skin through sweat. You see yourself sweating so much, maybe you went to the gym and the rest, sweating so much that your clothes is so wet like you bathe. Please ensure you take water, because at that moment you are dehydrated, you've lost fluid through the skin pores, and you need replenishment. So it's not only just urinating, it is also through the skin you can lose fluid, maybe due to high temperatures and the rest. So if you are consistently busy or constantly busy, dehydration is not a failure, it is a signal to plan smarter. Plan smarter. So I'll be dropping some preventive tips that can help us to avoid dehydration, to help us to stay healthy and avoid dehydration. Number one, drink small amounts of water regularly. Don't wait until you are thirsty. Drink small amounts. Take a sip like that. I don't know why I like saying sip, but to me, when I mean sip, I mean like a gulp of water, small amount of water, not that kind of tiny sip, as if you are sipping wine or juice. No, no. A gulp of water can go a long way. Then don't wait until you are thirsty. So for this to happen, just keep a water bottle around you, so that when you just look around, you pick it up, take a sip, and then you're good. You take a sip and then you're good. So that's it. The next, pair water intake with daily routines. If you are pairing it, first thing when you wake up, you drink water. Before meals, you drink water, or after meals, depend on the one that you feel convenient, either before meals or after meals. Some people drink both before and after. They drink a lot of water because maybe they have suffered several health issues and they are seeking ways to prevent it. Remember, these are preventive tips. So pair it. If you pair something with a daily routine, it will help you to keep to it. So you can decide that as I wake up, like I said, the first golden hour from the time you wake up, take water. Take water. If you forget, that time you remember, go and take the water. Thank you. So the next one, include water rich foods and fruits in your daily diet, like soups. Then you have some fruits like watermelon, they have a lot of water in them. So include them in your diet as much as you can afford. As much as you can afford. Then next, and very important, monitor your urine. I believe when you go to urinate, you don't close your eyes. You open your eyes, you look into the water closet. You will tell if your urine is very colored, because you will see the change of color in the water closet. So please observe your urine to see, monitor the color. If you see that it's becoming very dark and you know you are dehydrated, no one needs to tell you, quickly go and take more fluid. Then next, you have increased fluid during heat. When the weather is very hot, drink more fluid, it helps. Another thing that happens is that people tend to drop or reduce drinking water when the weather is cold. No, it is also not healthy. They say if I drink water when the weather is cold, I tend to urinate more, but don't forget that your organs still need this water. So you still need to drink, though the quantity you will drink when the weather is hot may not be the same as the quantity you drink when the weather is cold, but all the same, you must still drink water every day. A good quantity of water every day. That was why I started with the initial poll, that your water quantity should not be less than 6 to 8 glasses a day. And it's possible, it's achievable. Just take a step. And then you should also increase your fluid intake when you are sick. Yes, because a lot of things are going on in your body. So you need water to flush away those toxins so that you can recover faster. So take a lot of fluid. Then take a lot of fluid when you do physical activity. You went to the gym or you are doing indoor sports and the rest. Ensure that after that sport, you take a lot of water so that you don't become dehydrated. So these are very, very necessary. Fatigue that doesn't improve with rest should always prompt a hydration check. So if you are always tired and you even rest and wake up and you are still tired, please check. It could be that you are dehydrated. Take some water and observe yourself. You will recover and be stronger. So I'll be sending in some questions. I'll be dropping a poll. Let's respond to the poll. Can tea. I just want to hear our own responses to this. And coffee counts as fluids. Thank you so much for staying true to this point. I really appreciate your presence. Thank you so much. Thank you. So, can tea and or coffee count as fluids? Let me hear your response to this poll. Thank you. Thank you for responding. Thank you. So I see response as no. Tea or coffee can tea or coffee. So you're saying no to the fact that tea or coffee cannot count as fluid. Why do you think so? You can drop on the comment box. Why do you think used to in place of water, but they are still fluid? Hey, thank you so much. I now get you clearly. Yes. So you can count them as fluids, right? From what you said now, but they can't replace water. Nothing can replace water. Let's take that home today. Nothing can replace water. So even if you take tea, you take coffee, you take fruit juice, soup, whatever, you still need water to also help digest all those nutrients. So nothing can replace water. They can count as fluids, but they cannot replace water. Yes, taking soda, taking all these drinks, sweet drinks and the rest, carbonated drinks cannot replace water. So we should not do that. We should always ensure we take good quantity of water. So I'll be sharing another poll just immediately. Thank you so much for responding to the earlier poll. How much water is enough? How much water is enough? Okay. How much water is enough? I'll leave this question open. So I'll use question and answer instead, not a poll. I'll use question and answer instead. So how much water is enough? It's a question. So let's respond. Water do you think is enough for you in a day? Let's use what we can quantify in our environment. And let me hear from you. Let me hear from you. How much water is enough? Permit me to turn off my camera for some few minutes. How much water do you think is enough for you as an individual? Yes, I'm expecting our responses. Okay, like 5 sachets of water is enough. Wow, that's great. You know, 1 sachet of water is like half a liter. Yeah, I you know where we are going to. So 5 sachets of water will be 2.5 liters, and that's a great one. That's a great one. Like 5 sachets is a great one. So we are good. Thank you so much. Yes, I'm expecting other responses. Okay, 6 to 7 sachets of water. Okay, that makes it up to like 3.5 liters. That's a great one too. So 6 to 7 sachets of water is a great one. So I really appreciate you staying true. I'll be asking one more question and we wrap up this session. This one would cause us to think a bit and reflect. Does dehydration affect blood pressure, blood sugar? Okay, I want to hear from us. Let's share our thoughts. Does dehydration, not taking enough water, does it affect our blood pressure or blood sugar? I would like to hear from us. Oh yeah, Favor, you said you think it does. Thank you so much. But if you think it does, how? The blood pressure, will it lower it or make it go high? The blood sugar, will it lower it or make it go high? What do you think? Yeah, I'm still waiting for more feedbacks. You said, Favor, you said you think it does. Okay, yeah, you said blood sugar will go high. Blood sugar will go high. Yes, yes, yes. That's for dehydration. Yes, blood sugar will go. Very correct. That's very correct. Why blood pressure will go low? Wow, so great. Such a wonderful answer. I'm really, really grateful. And you're so absolutely correct. Okay, so let me explain the reason why it would be so. So the blood sugar will go high. Why? Because now your blood is concentrated, and normally taking water should help dilute it, right? But now you've deprived your body of water that should have helped to dilute it. Just think of a cup of tea and you put like 10 sugar inside, just half a cup of tea. I know your face will be like, ah, but that's like, I'm using it as I'm using it as an illustration. A cup of tea, and then you put like 10 cubes of sugar inside, half a cup, not full the cup, half a cup, and then you stir it, you taste it. Oh, so sweet. That's a cup of tea now. And then you now decide to add more hot water to the cup to fill the cup. Remember, it was half full. Now you now added more to fill the cup. So what will happen there is that it will now, just tell me, type in the comments, what do you think will happen to that the taste of that tea? Oh, Favor, you say I think I should go into nursing. Wow, 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 that's lovely. That's a lovely one if you decide to. Nursing is a great career. Oh, Eunice Intiyari, you're welcome. 4740, you're welcome. Please tell us where you're joining from. Thank you. Today we are discussing on signs your body tells you when you are dehydrated. So we are about wrapping up and I will give the breakdown on everything. Just stick with us. So this is the question I'm asking. Does dehydration affect your blood pressure or your blood sugar? You can type and then let's flow along. Thank you. Okay, the sugar level in the tea will go low when you add more water. Thank you. It will go low when you add more water. Now, I'm using that as an illustration now. You have a cup of, I use that cup of tea, half cup of tea with 10 cubes of sugar, then you added more water. The same thing with your body, the blood sugar in the blood. If you drink more water, it goes to dilute it, thereby reducing it. But if you refuse to drink water, it will keep the values very high. Your blood will be very, very consecrated, as in concentrated with sugar, which can affect you a lot. And then for your blood pressure, when you don't take enough water, like you mentioned, it's like a direct opposite. Blood pressure will go low, blood sugar will what? Go high. So it's inverse proportion when you don't take water. So blood pressure will go low. How would it go low? Let me explain with this illustration. If you have a pipe of water and that pipe is used to pass fluid over time, and over time there are some you will notice that the flow of that pipe would be affected. Most times you want to, pass a something, a device through it to like clean it, to remove whatever is blocking the flow, free flow of water, right? So the same thing applies to the blood. Now, you not taking enough water will make your blood to be a bit clogged, no water allow it to flow freely, so it will be clogged, right? And when it gets clogged like that, it will no longer flow with the usual pressure, so your blood pressure becomes low. So when your blood pressure drops like that, it's really, really advisable. It's a tell sign of dehydration, and it's advised that you take enough fluid to, help your body catch up and become better. So we'll be wrapping up today's session. I'll be once again listing out the signs. First, I said fatigue, persistent fatigue. It tells you that you are dehydrated. Headaches and dizziness, it tells you that you are dehydrated. Dark urine color, it tells you that you are what? Dehydrated. And then problems with digestion and so on tells you that you are dehydrated. So with that will be dry mouth, dry lips, bad breath, poor concentration. All these are signs of dehydration, and please, let's watch this sign. Dark urine color especially, let's take note of this sign. And dehydration, I'm challenging you today to take good quantity of water. Drink one extra glass of water and observe how your body feels when you take water. As I even round up this session with you, I'm going to take water so that I will be refreshed once and again for other activities. Thank you so much for sticking through. Oh, Eunice. Yes, it does. That's why the doctor advises us to stay hydrated always, not to stop, not only to stop constipation. Thank you so much, Eunice. I really appreciate that response. Thank you so much. So we are wrapping up this session with these few signs. Dehydration has caused a lot of cases, kidney cases. I know of kidney stones, and you don't want to experience that, the pain and the discomfort. You don't want to think of it. So as a nurse, I decided to come your way sharing these signs of dehydration so that we take note of it. Remember, the first golden hour from when you rise up from the bed, the first hour, let's take water, a glass of water. It helps to cleanse us and helps us to prepare for the day. Thank you very much. I don't know if you have any question. I'll be giving some few moments for questions. So if you like this, please give it a like. If you like the live session, please give it a like so that it can also pull other people to watch this content. You can share it to your friends. Let's also remember that if these contents were helpful to you, please subscribe to this channel. And then let's remember that fatigue is not always stress or lack of sleep. Sometimes your body is simply asking for water. Take a glass of water and it will go a long way. Thank you so much. Thank you. Thank you, Eunice. I really appreciate you. Thank you. Thank you. I don't know if you have any question. Favor, are you still there? Do you have a question? Oracle, do you have a question? Are you still there? Please, we should never replace anything for water. We should never replace anything for water. Water still stand out uniquely. And okay, no question. Okay, thank you so much for joining. I really appreciate your presence. Thank you. Thank you so much.